probably doesn't surprise you. The data, we found a lot of data about this. There are lots of providers. By the way, the data that we have, you all realize data is a snapshot, not a movie. So anytime you write, I'm going to just throw out some stuff which may need updating with the 208 data that just came out. We did a survey, as you heard, grassroots folks. Mostly would be social services customers, low income. They said that the top food and nutrition needs in Nashville were, number one, an increase in the amount of food stamps they can get. And basically this comes down to eligibility. You've already heard, you earn a little, you lose a little. We heard that the amount of food stamps someone can qualify for, they don't consider it worth it to go through all the hassle to get $10 worth of food stamps. And there are folks in Nashville who would qualify but just haven't applied. So we can't change the eligibility limits. They haven't been changed for quite some time. And like the federal poverty level, I think they're unrealistic. That's my personal viewpoint. So they said they need more food stamps. Interestingly, they pretty much all agreed that the second need was more fresh food for folks who are elderly and disabled, kids in school, and neighborhoods that didn't have access, no grocery stores. Those are called food deserts. The professionals that we talked to said their top unmet need for nutrition was food for elderly, disabled, and low-income people. So basically the message is the individuals that we talked to in focus groups talked about food for vulnerable folks, and they didn't necessarily count themselves in there, and quality food from food banks, from food in food boxes, not in school, children's school lunches. The things that they said on their surveys and in focus groups were backed up by other data. 211, Tennessee 211, for example, the largest number of calls in 2008 were for combined food and food stamps. Calls for food help increased 90% from February 2008 to 2009. There are people hungry now and worried about where their next meal comes from who never had worried before about that. And a lot of them, they're just lost. They don't know what to do. They don't know where to ask for help. Sometimes they put it off a long time because they're kind of ashamed to go ask for help, ask for food, because they've worked all their lives, et cetera, et cetera. You probably see some of those in your work. U.S. Conference of Mayors Task Force surveyed 13 cities. Nashville was one of them. And they reported, this was last year, 2008, they reported we had a 13% increase in emergency food assistance requests. We had a 20% increase in the total quantity of food that we distributed. And at the same time, we had a 38% decrease in the amount of funding that was allocated for food and nutrition in the city. So demand's going up. Resources are certainly not keeping pace, maybe dropping down. Nashville schools, 2008-2009 school year, 72% of the students qualified for free and reduced price lunches. 40% of the people in Davidson County, according to another survey, report that they often skip meals or worry about food. That's just horrible. It's just horrible to not know where your next meal is coming from. So the takeaway message here, I think, is that in Davidson County, as with some other areas in Tennessee, there are lots of food and feeding programs, and food nutrition is recognized as a real need, and there are lots of churches who hand out food and volunteers, and it's not enough. It's not enough. The second kind of message is that the food that is given out and given to our school children should be better quality and fresher.